And now, is it right to crack down on sickness benefits? 020 7862 2222. The government is planning the biggest welfare reform in a generation, we're told. Work and Pension Secretary Mel Stride is proposing sickness benefits should cease for many, many people with depression and anxiety. So people with those conditions will be offered, he says, meaningful support, such as talking therapies and social care packages. Mr. Stride says the system there is should not be paying people to deal with the ordinary difficulties of life. He also wants to give vouchers instead of money for some people on disability benefits. Those plans would likely stop payments for a variety of mental health and other problems. Mike, what do you think?
Well, look, I just think we've got a huge problem in this country with people who don't want to go to work. We've got nearly 10 million adults who are not looking for work. We've got a load of young people who aren't work. One figure here which really frightens me. There are 360,000 people claiming PIP, that's the personal identity payment, right, for anxiety and depression, double the figure from 5 years ago. Now, how come that figure has doubled in 5 years? Many of the people in that figure are what's classified as young people between 18 and 24.
And 360,000.
360,000, OK?
So, stop right there.
Yeah.
Is that defensible, Marina? Because if it's doubled, then surely, I suppose logically, unless there's been a massive increase in those conditions, half the people wouldn't have been claiming 10 years ago and shouldn't be claiming now.
5 years.
5 years ago.
So have things improved? Has life improved for people? Have things become more easy for people, or have things become more difficult? And I just think
that doesn't mean lives are difficult, for sure. Right. That doesn't mean you get ill.
I think what's happened as a result of things like the cost of living crisis, the fact that we've taken away the motivation to work because the social contract is broken, you can't buy a house, you can't rent a house, you can't heat a house. I think now there are so many stresses of life, and not these ordinary everyday stresses that Mel Stride talks about, which I think is insulting. But I think people have now got bad health, proper serious issues of anxiety and depression. And the problem is they can't get them cured because the services they require to cure them are
that's for sure.
Don't have 2 million people waiting for help.
The bar for mental health problems has been lowered so low. Plenty of doctors now, and I've heard them discussing it, and there's a doctor in one of the newspapers this morning saying that, I don't know where it comes from now, but the bar has been so lowered for the category of mental health problems, which used to be having a bad day, bit fed up, broken up with a relationship or something like that. Now all classified.
Oh,
and the other thing,
where have you read that?
Marina, and the other thing is, and you've touched on it, is that...
Let Marina come back on that.
Sure.
Mike, that's just sensationalist nonsense. And I know
what is sensationalist nonsense?
You're saying if someone's broken up with their partner, that they get classed as being depressed and then they can't work.
It comes
right,
into
do you know what?
categories.
There is, OK, I am not denying that there are feckless people who do not want to work, who scam the system, but I don't believe they are in the majority. I feel like so many people who have got these debilitating... If you have anxiety, if you know someone with severe anxiety and you try to push them into work or take away their safety net, that is going to be catastrophic.
May not make them better?
I don't doubt that there are some jobs that might help their mental health, but for some people, that is not the solution. Okay. They need to have some sort of therapy.
Let's go to Suzanne in Norfolk just before we'll come back to it, I promise. Suzanne, hello.
Hello.
What do you think of what Mr. Stride is saying?
I think it's completely wrong. I am on disability benefits. I'm on universal credit and PIP.
Yep, this is the personal independence payment, yeah.
Yeah. For lifelong health conditions that I was actually born with.
So wait a minute, but he's not talking here about physical conditions. What's yours, may I ask, Suzanne?
Heart problems, which I had a heart implant last year.
Yeah. Well, I'm sorry to hear that, first of all. And you've never worked, is that right?
I have worked, but I am limited to what I can actually do.
OK. Well, Mike, at that point, do you say, well, hang on a minute?
Suzanne, you should be looked after by the state. You really should, because we are a caring nation. We've got a welfare budget of 265 billion quid a year to look after yourself. But, Susan, don't you think that some people are perhaps taking the mickey when 360,000 people claiming what you get, PIP, are claiming it for anxiety and depression twice what it was 5 years ago? Surely they're jumping on the bandwagon.
I think it's completely wrong, because sometimes these benefits that we've got, they could be a reason behind those situations.
Okay, sorry, but should they be paid to young people who've got depression? That's the question.
It depends, because it depends on what the issue. If they're mental health, it could be a mental health issue.
All right, Suzanne, bless you. Thank you so much for calling. You take care. Maybe we have widened the definition of depression. That we've got more people saying they've got it.
I think we've probably got more people who are also
Well,
depressed.
Harry and William have both said they've had depression. And it's like, I suppose, on that definition, they may have had, they may not have had, I don't know. But more people are in the position where they say they've had it.
Yeah.
And they may not have done.
Do you also understand, like, the living conditions now, like, so many people just day in, day out, going to work, and they still cannot afford to make ends meet. That stress, that constant stress.
Why was it? It was stressful in the 80s, wasn't it? I mean, we had nuclear missiles pointed at us.
And we're on the verge of World War III here.
Well, it was worse in the 80s.
I just think there just needs to be
worse
a
in the
little
70s.
But also,
It was worse in the 40s.
Can I also just bear in mind, please bear in mind, in the 1990s, our sickness levels were higher than they are now. So context is really important here. We're not the sick note culture that we're being made out to be.
That's interesting as well. Thank you. We've got Rowena in Cheshire. Rowena, I think people are concerned that the minister is targeting mental health.
Yeah, I don't think he is. I suffered from sort of depression and anxiety from being a child. And I worked for 51 years. And the thing that helped me was going to work. And since I retired, my depression's gone worse.
Well, that's so interesting.
You haven't got anything to occupy your mind. You've got too much time to think.
But if you were, as a depressed person, can you see clearly that work will help you, or do you need someone to tell you?
Definitely work helps you. Definitely. I mean, you agree with anybody with diagnosed bipolar or schizophrenia or any of the, sort of really bad depressive illnesses, we understand that they can't work. But people with anxiety and depression are medicated. And most people don't even need antidepressants. They are actually fed up. I mean, I knew a woman from years ago, and she was on the sickness benefit all her life. She used to get antidepressants off the doctor. She'd put them down the toilet when she got the prescription. And before she had to have a blood test, she used to take them for a few days before, so that it was in the system. But it's too easy. I mean, if you get sickness benefit now and you get universal credit and you get PIP, you can be getting £1,400 a month for doing nothing, plus your rent, so over £2,000 a month. And these people couldn't even earn that in a normal job. They're getting more money than what people who go to work get.
Okay, Rowena,
That's an interesting point right there, though, isn't it? That's the interesting point right there. Why is that the case? Why would they not be paid £1,400 plus in a job? Again, this is because people are being forced to go into jobs where they're going to be on minimum wage and they're still not going to be able to afford to make ends meet.
Yeah, but
that's how the market works.
But it's not how the market works. It is how the market works. It's not how the market should work.
That lady on those figures, right, because I saw an example of this last week, that's a salary of £40,000 a year. Because remember, all that comes tax-free. Now, £40,000 a year is a great salary. And the example I saw last week was a chap who got £1,300 a month, plus his rent paid, and boasting about why would I go to work. And do you know what? If you're in a childcare position, you'll know about this, Marina, and your salary gets to a certain level, it's better then to stop working, because if you lose the child benefit on top, you are completely dependent on the state.
Right. We'll talk some more in a moment. Thank you, Rowena, so much, and all the best to you as well. After the break, more calls on whether it is right to crack down on sickness benefits. But Marina and Mike are with us this morning. Later, we'll be asking if we need a limit on migration. So actually a flat number, no more people after that. And should Royal Mail just stop delivering on Saturday, because there's no point? Now, more of your calls on whether it's right to crack down on sickness benefits. Andrew's in North Dorset. Hi, Andrew.
Yeah, hi, Jeremy.
What do you think it's about? A lot of this is about young people with depression and anxiety.
Yes, I think the government need to be tackling this at source, because I think there's a real danger here that we're going to persecute people that genuinely need the help. They're not getting the right diagnosis. They might just be labelled as depression or anxiety, when the truth is the mental health support services are so run down, so oversubscribed, that perhaps they're not getting the real treatment for something that's more serious, bipolar or, more serious mental health conditions.
Yeah, I suppose it's unlikely we'd have that. It's unlikely we'd have an outbreak of bipolar on this scale, because bipolar is a very specific mental health condition. So,
okay, that's just an example.
Yeah,
but
all right.
I know from first-hand experience that the mental health services are absolutely terrible, especially in rural areas, particularly where I am.
Yeah. So have you struggled yourself?
To the MPs about this.
Have you struggled yourself, Andrew?
It's actually my partner. My partner has been very unwell. It's taken her about 10 years to get a referral to London, where she needs to be to have something a bit more in depth. And because she was just kind of put into a general, it's depression, it's anxiety. And it's taken, 10 years really to get her to a point where she's going to get this looked at properly. I've been pleading for people to try and help Jodie to get her well, so that perhaps she can get back to work, I can get back to work, and we can start getting on with things. And that's the way to tackle it, in my opinion.
Understood. Thank you so much, and best wishes to Jodie as well. Joy in Edinburgh, hi.
Hi, Jeremy.
Are there just too many people here on the list with depression?
Well, so I've just turned 30 and I live in Edinburgh, but I was raised in a place called Dundee. And to make the point earlier on of Scotland now being the drug death capital, Dundee actually is the drug death capital, suicide capital of Scotland. Right? So, of course, there is actually, mental health, and there is definitely something that has gone wrong. However, growing up in Dundee, so I'm an immigrant to the country, we came here and we knew we needed to work to survive, okay? Yep. Now, it wasn't easy for us to fit in, especially a place where I was the only black kid in my school. I had so much abuse given to me. My mum, when she went to the workplace, she was, outcasted and things. However, we had depression, we had anxiety, but at the end of the day, basic human instinct kicked in, which is we need to get up, we need to go to work because we need to eat and we need to survive, okay? Now, I believe that, for example, if a parent is bereaved or someone is bereaved of a child or a family, of course, I believe they should receive support. However, my peers that I grew up around, because they made bad lifestyle choices, okay, and yes, we can go into, well, why do you make these choices and things like that. Right, yeah. I do believe that a lot of their parents made these choices, abusing alcohol and things, and so children kind of grew up seeing their parents. Yeah.
Go, sorry, I'm just trying to get to it. So forgive me, Joe. We've got so many people calling. What is your view that people should people be paid unemployment benefit for depression?
I think that the bar has definitely been lowered, and I know personally that they do actually take advantage of the system. So they get the payments and they spend the money on alcohol, as we call it, getting on it over here, alcohol, drugs, weed, and things like that. They buy tracksuits, they buy phones, and they literally stay in that place, because if there's no incentivization for you to have to go out and survive.
Thank you very much. Thank you so much. Victoria in Greater Manchester, hi.
Hi.
Now, you're a mental health professional, correct?
That's right. I work for a crisis mental health team.
Joy was painting a portrait there of people who almost have chosen to be unwell.
I think in terms of what you said earlier in regards to people taking advantage of the system, there will always be that population of people in any area. There's people taking advantage of the position within Parliament, MPs, etc., in terms of expenses. So you're always going to have people who take advantage of the position that they're in. With the point that Andrew made in terms of people being persecuted who are genuinely unwell, this is what I worry about, because the trouble with these debates is that we tar everyone with the same brush and put them under the same umbrella. Should all people with depression and anxiety
we're taking our cue from the Minister Mel Stride, and this will be an election issue. So he is going to say you can't get long-term benefits for mental health. That's where they're heading with it. And you think that's wrong?
I think that's wrong because the problem lies with the interventions. There's a shortage of proper intervention that needs to take place.
Of course, that's part of it.
If people are in the workplace and they had access to a service within the workplace that supports them to keep them in work, the likelihood of someone going off sick is,
but employers aren't going to want to pay that for that.
Well, probably not. Victoria,
there lies the bigger problem.
Yeah, Victoria, because you're in the business, so to speak, can I just ask you, do you think doctors should still have the responsibility to sign people off with mental health problems when actually doctors' surgery are so overwhelmed? I've heard even from doctors that I go to, do you know what? It's better to sign them off and get them out of the surgery and get the next patient in. Shouldn't that responsibility go back to the Social Security Department rather than doctors?
Absolutely. Because GPs don't have the time to be able to fully assess properly that person's mental health in the 5 minutes that they have with the patient.
But all right, thank you, Victoria. It's difficult, isn't it? Because I think the so-called Social Security or DWP, I'm not sure they've got personnel to do it. You would need to bring in, what they're thinking of doing is bringing in some sort of a squad.
Absolutely.
But I mean,
that's got disaster written.
But we had that with people being analysed for universal credit and being told that if you got to the room for the interview, you were okay to work.